Okay, let me simply introduce ICON. ICON is a BC emergency digital emergency program. Is conducted by Dr. Kendall Ho. It's been gone on for 17 years, and it will give to multicultural community patients and the family, giving everybody the chronic education, prevention, and self-management, and through the health webinar and also using online information, it can increase the patients knowing the management and also the lifestyle and also prevent and reduce the risk. And also at the same time, it would promote communication between community members and health professional, and also optimize the people's knowledge of digital information and improve their life quality. Okay, well, so today we have many speakers to talk on many topics. This is to strengthening health and wellness as we age, to understand frailty. This year, we only had one webinar just for one day. Today, we arranged for 3 hours to broadcast here. Our Q&A will be postponed to August 19. Please pay attention. But today, you still are able to pose your questions. Okay. Today, we are very fortunate to have many medical VIPs talking to us many aspects of frailty, to share resources, and also as we age, to strengthen our health. And we have Dr. Thomas Ho. He's a family doctor. Amy Yu, she's a registered dietitian. Wendy Lam, registered occupational therapist. Nicole Tai and Emily Peck, registered physiotherapist. Dr. Tigerson Young, clinical psychologist. Ken Lin, community pharmacist. Winnie Lau, registered psychiatric nurse. Thank you to all of you to take time from your busy schedule to take part in the webinar. And also, let's, without further ado, we invite Dr. Thomas Ho. He's a very experienced family physician. He's been practicing for over 40 years.
Good morning, everybody. Good morning, everybody. Okay, so our topic, our theme for today is frailty. And Dr. Ho, you have served so many senior patients. So do you see many patients with frailty? Well, frailty, the Ministry of Health and the medical community pays a lot of attention to. So based on statistics in Canada, people who are 65 years plus, there are more than 600,000 people. So by 2023, it will be 2.5 million seniors with frailty. And then we need 7.5 million people to take care of them. So this is a big issue. So what is frailty? So frailty is not a disease. It's not like a heart disease. It is a health condition. It's the reduced functionality of the body. For example, people getting frail, and when there is a little bit disease or stress, and then people would feel sick get ill, and then it's hard to get recover, and then the quality of life gets reduced, and it's hard for them to take care of themselves, and also cognition issues, and then the death rate is 2 to 3 times higher than their peers. So early detection, early intervention, early treatment, that would be very helpful. And also old age seniors, when are we talking about the same thing? No. When you get older, yes, it's you have more chances to get frail, but still we can see lots of people in their 70s and their 80s, they are quite strong and healthy, but then some are not. So some younger ones, they are frail, and some older ones, they are quite strong, quite energetic. Okay, so just now you talked about when you get older, it doesn't mean you get frail. So not all seniors will get to this stage. So any signs or any indicators, what are the signs so that we can detect? Yes, when we have to pay attention to any changes in our body, and also your family members and the caregivers also have to pay close attention to make sure to let the to inform the healthcare providers. For example, the signs you have less you lack of appetite, and you lose weight unintentionally, and also you easily get tired, or you recently you walk quite slower and easier to fall for multiple times, or so you used to be quite active and recently you're slow, you are less active, and you don't go out that often, and then also your memories gets poor, you have to be reminded many times, and then you just forget what you just hear, and also your emotions, you are in low mood, and also in your daily life you are less independent, you rely more on other people's assistance. So we can early identification, and that would be great, very helpful. The symptoms, and we can let the doctors know, or the healthcare providers know that, so that we can make sure we have early intervention, early treatment. For example, you just use when you drink, you have coughs, and then you're quite sensitive to the drinking. Maybe it's your swallowing issue, and every time you drink, and then the water goes to the throat, and then you had aspiration, and that's so we have to go through swallowing assessment test. And another example is that a senior, when she gets up, and then it takes time, takes more time to get up, and then when you get up you are emotionless, and then when your hands and legs are like you you can see think your movements are much slower. Is it Parkinson? You have to we can try to find out. And then another example is that a senior doesn't want to do anything, just sitting there, and then no appetite, poor quality of sleep, or that might be an early sign of depression. So these are the signs we have to pay attention to so that we can offer help. Yes. So just observation of their daily life activities to to see whether there's family members and caregivers. You try to observe any signs of that, and then you can contact the health professionals. Yeah, and also, is that a sign of frailty or other chronic diseases affecting the body's functions? So if a family member notice a senior seems to be there are changes, they can observe some changes. So the medical community, how do they do the assessment? How to is there something we can do calculation when it comes to frailty? Well, frailty, you can say there's mild, moderate, or severe. There's a clinical frailty index from 1 to 9. 1 is you're quite energetic, quite fit. Yeah. And then when you go to 5 or 6, then the senior can go out alone, or to do banking, or take public transit, or can able to do self-management of the medications and some heavy household work, or another situation that doesn't want to go out and then rely on family members' help, like showers, going to bathrooms. They all need help, and also 3 meals a day they need help, and that's the reliance on other people, and all the way to you rely on other people on everything. So we have this frailty scale, and when the doctors and family doctors and geriatrician would do tests like blood tests or assessments, and then we have some tools to help us. For example, the mobility, we have this time up and go mobility assessment, to go a few steps and then you turn around, and then let's see how much time you take. And also your intelligence, we have a MMSE. That's a simplified intelligence test, and lots of questions, a total score of 30, like what's the day today, and then something to remember, and then to do some calculations, or to copy something, or to draw something, and then we can do the assessment to see the memory, and then you get a score like 15, that's moderate, and then 1 year later, half a year later, and then there's is it any progress, or maybe you'll get to 18 or to 10 points. So we use those tools to do the assessments. And also we have a multidiscipline, like a team, team members from different disciplines. We look at the medications, the pharmacists look at the medications, and then physiotherapists look at the physical activity. So there's a team to work on it. So the most important thing is that the family members and then or the patients themselves, when they have this, when you find out there's a possibility, they have to contact family doctors to see whether are you in that situation, in that condition, and then to seek help, and then to contact different departments to get help. So when it comes to managing frailty, patients with frailty, so what are the recommendations from doctors? How to help? Yes, management. First of all, seniors, they are getting frailer and frailer. So we have to know what their wishes are. Like if they are not cannot make it that clear, then we can ask their family members, like whether they want to go through CPR or when there's a heartbeat problem, and then the advantages and disadvantages, and also the goals of the care, and because you have to go to ICU, lots of tubes, and then to maintain the breath. So I don't like it. I just want to be in my comfort zone. So we have to have that communication with the family members or with the patient, so that we know what their wishes are, what their goals of care are. So then the team can have a better understanding of how to help the patient when you get older. So we have different ways of dealing with a patient. Like, for example, when you have diabetes and when you are younger, then your rate and then the assessment are good. But seniors, maybe we have less restrictions, maybe 8.5, that would be okay, 8.0, that's okay. And then make sure the blood sugar is at the appropriate level, and also taking into consideration the quality of life. So we have different goals for people with different ages. Yes. Medication. Yes, when it comes to medications, medication management is also very important, because when you get older, you take more medications, and so you have to try to simplify things. That would be better. Sometimes when you I'm so used to these all the medications, I don't have to go to see the doctors. But your body is changing, and then your functions, and then you have to, when it get to a certain point, some of the medications are not that appropriate, and then you have to review the medications, because the medication, they help us a lot, but then also they have the advantages and disadvantages. We have to review the medications at a certain age, and what's the ideal, what's the most effective. And so that's why we have to do the review to reassess everything. So the pharmacists can help us, and you also have the drug interaction issue. So interactions between drugs, we have to also pay attention to.
So it's very important as age changes, the medication and the use, and there would have to be changes. Yes, correct. It will not always be the same. There will be changes. Okay. Finally, so if at home one can't manage, then how can we help them? And this is a very practical issue with seniors as they getting more and more frail. They need more and more care sometimes, especially when they are incontinent in terms of the passing motion and peeing. Then it's very difficult for the caregiver. There's many resources in the community. Later on, we have a session. We will talk about many useful information will be provided, how to apply for assistance, where do you make inquiry for the worst case palliative care, and also they have that too. That's the social resources are very useful. Okay. Finally, any way to prevent? Of course, we have some tips. We have to try our best. First of all, like I said, we have to take care of ourselves. We have to see whether there's a lot of weight loss, and you have a blood pressure equipment. Check your blood pressure, and every now and then your blood sugar and cholesterol. Get the doctor to follow up on those. In terms of diets, of course, you must be average. Don't take too much junk food. Take fruits and vegetables and all whole grain, fish and tofu. You get a detailed description, and vitamin, you have to pay attention. Vitamin D is very helpful to many seniors for osteoporosis, and also prevent them from falling, and also helps increase our immunity, and also prevent diseases from invading. And B12, if it's too low, you have to supplement for the brain. All this would be very helpful. And the most important thing that I have to talk about is exercise. Exercise is very helpful to our health. Many seniors say that I'm aching all over, I have arthritis, I can't move. What's there to exercise? I just sit down, lie down, and watch TV. That's the best. That's incorrect, because as in the hospital, even if you lie in the hospital a few days, they will help you. They are afraid that your blood vessel will get congested, and if you lie down too long, you might get pneumonia. So one must move. If I say, if I'm like this, how can I move? Then I'm so weak. Even if you are in pain, you have to move. Actually, there are many things to help to reduce the pain, like Tylenol is safe, make you less painful, so that you can start moving, strengthen your muscles. Once you get back your health, everything gets better. Of course, exercise, there are many types of exercise. Everybody's exercise amount is different. Physiotherapists would teach you what's most suitable for you. So after a heart attack, they would be required to start exercising quickly. It's not like after your heart attack, you will lie down without moving. Once you're stable, you must start moving, not just sitting there. So exercise is you not smoke, also alcohol. Try to reduce alcohol intake, and also we have to cultivate some hobbies, some interests. Positive. Everything must be positive. Don't think like I'm old, whatever. I'll just sit here and they're waiting to die. No, don't use this kind of attitude. Dr. Young, psychologist, will talk about psychology and also depression in seniors. So we have to get old but not retire and stop, and we have to maintain our exercise and also a regular physical examination, because a lot of people say, I don't have anything. Actually, after examination, you didn't know that you have. Without examination, one is unaware. So we have to treat every other condition when it's at an early stage. We're hoping to get old and not frail, and not get frail before getting old. Okay, thank you, Dr. Ho, for describing in such detail all aspects. So those who are taking care of seniors at home, please pay more attention. We have many resources. I know people who are online, who are on site. You might feel that I want to copy down the resources. In information or the community resources, please don't rush. When you are on site, you already have a booklet that has got all the community resources printed in your booklet. And people who are online, our friends online, we have a UPC code for you to scan, and you could get onto our website and also look at all the community resources. Don't worry, everyone. Okay, thank you, Dr. Ho. There's some upcoming events. We are busy in July, August, September. In July, we have 2 dates that's been scheduled. One is July 12th, one is July 22nd, both in the morning, 2 different webinars. Is to do with the summer extreme weather series. One is managing chronic kidney disease during extreme summer weather. The second one is chronic disease management during extreme environmental conditions and wildfires. And also in terms of respiratory system, we have 2 speakers to talk to us. And that's in July. In August, Tuesday, August 13, using apps to support your health. We also have Wendy, who talked to us today about fall prevention. She'll talk about that topic. And on August 19, we go back to today's Q&A session. If you have any questions, you can write them and send them to us. We will arrange for speakers to answer all the questions raised. And in September, that's our annual the Success Health Fair. That's on September 15 on a Sunday. It's an all-day activity. ICON arranged for 2 speakers. One is specialist doctor to talk about chronic pain management, and the other speaker is family doctor to talk about using apps to support your health. I hope you all will pay attention. And your way of contacting us, there are many ways. You can see those on the screen. Keep in touch with us if you are subscribing to our the newsletters. You can join in this email correspondence. There will be, when there's a webinar or other activity, you will be informed directly. ICON, thank you very much to the Patient as Partners Initiative support, and also we are thankful to our community partners. Thank you to our media partners. Thank you to all the viewing hubs community partners. Lastly, we are also very grateful. Thank you to our speakers today, including Dr. Ho, Amy Yu, etc. Lastly, we have to thank all our several interpreters behind the screen doing the interpretation for us, Shiny, Susan, Linda, Adam, and also thank you, MB Interpretation Services. And hopefully next time when we have the webinar, we'll meet with you again.